Hi everyone, my name is Eric Williams. I'm an advisor here at OASS, and we're going to be getting started in just a minute while we wait for maybe a few more folks to join us. Very glad that you're joining us today on this very important topic. Maybe it's not all the answers in terms of immigration that you may be looking for at the moment, but it is a very important topic for you to know and be aware of. Once you get to UCSB, so that you know how to get healthcare and stay safe and healthy and all of that good stuff while you're here as a gaucho. So I'm going to go ahead and let the folks that are here from Student Health introduce themselves. There's a few more than I thought there would be, so that's exciting. So we'll go ahead and start with Dr. Javenbach.
Hi, everyone. I'm Ali Javenbach. I'm the medical director at UCSB Student Health. Glad to be with you.
Great, thank you. All right, Karina.
Hi, everyone. My name is Karina Herrera, and I'm the Immunization Compliance Coordinator for Student Health. Thanks.
Stacy.
Hi, my name is Stacy Iman, and I am the manager of the Student Health Insurance Office, so I can answer any of your questions about our insurance plan or waiving out of our insurance plan.
Great.
Hi, everyone. My name is Eric Newlove. I'm the budget director for Student Health.
Great. Thank you so much for all of you for being here. This is great. So I'm just going to start very briefly to give you an idea of how healthcare is a little different in the United States than where you might be coming from. As you're aware, healthcare in the US is privatized, so it might be very different from where you're coming from your home countries. So the biggest takeaway that we really want you to be aware of is that you really should be going to student health first. If you are feeling sick or having any issues, go to student health first. Maybe in your home country, you might think, I'm just going to go to the emergency room first. The emergency room should not be your first stop here in the United States unless it's truly an emergency where you need immediate care. But if you're just feeling sick, like you may have a cold or a flu or anything like that, we really want you to use student health first for your care. If you were to just go to the emergency room if you had a cold or flu-like symptoms, that could cost a lot of money. So we just want you to be aware that things are a little different here in the United States, but I'm gonna let the experts from Student Health go into more detail and kind of give you the do's and don'ts and basics of what you should do. And I do want to emphasize this is about student health, so we won't be covering any immigration questions. If you have immigration questions, we do ask that you email us separately so that we can address those at a different time. But this session is strictly about healthcare and student health. So I'll go ahead and let those folks from Student Health take it away.
So I guess I can start. Usually during our orientation sessions, we have a presentation that's given that sort of just goes over all the different types of services. And so I'm not sure if the group here is already signed up for those general student orientations. So we can give just really briefly the basics of what Student Health has to offer. We have, it's a medical clinic with all kinds of primary care services and specialty services, and pharmacy and an eye center, dental care. So it's a pretty full service facility for you, and it's right on campus. We do have also, as was mentioned, there's an insurance plan that all students are automatically signed up for. And so this might be something that's new and different for you, where we have an insurance plan, and you have to have some sort of an insurance plan in the United States before you go to a doctor's office or go to the emergency room. And UCSB has a student health insurance plan that we will enroll you in. And there is a fee for that, and it's charged automatically to your BARC account each quarter. However, we also do allow students to provide proof that they have adequate medical insurance through some other means. So if they have private insurance through their family, or they may purchase a insurance plan on their own coming into the United States, then we do allow students the option of what we call waiving out of our insurance plan, and then you wouldn't be charged for it and you won't be enrolled in it. And so just the basics of how that works is you would have to show proof that you have some other kind of insurance, and it's submitted through our online student portal. The big question I think a lot of people are wondering about is what happens if when we start school, we're going to be attending remotely and we're not going to come to the United States. Well, then, you know, do I need to have health insurance? As a UC student, we still have to enforce the UC Regents policy, their mandate that all students still have to have insurance of some kind, medical insurance, medical coverage of some kind. So please just keep that in mind. Don't assume that just because if you're not actually going to come into the United States, or if you're going to be attending remotely, then don't just assume that you no longer need the insurance and that it's just going to be canceled, because what happens is we're still enforcing our insurance policy for all of our students, so international students included. And you would have to actively go through the process of waiving out of our insurance plan. So it really just depends on what kind of coverage you have. If you have adequate insurance from your home country, the trickiest part is going to be that as an international student, we have a requirement that your insurance also provide for repatriation and medical evacuation. If something happens to you when you're in the United States, those are parts of an insurance policy that you may not currently have residing in your home country and not being in the United States. So those might be not included in your insurance policy currently, and it is part of our UCSB student health insurance plan. So if you would like to opt into our insurance plan, you just basically don't have to do anything and we'll enroll you automatically. But if you do waive out of our insurance plan, you're going to need to provide proof that your insurance meets certain criteria. Now, if you're outside of the United States, you're not coming into the United States, we would have to make a special exception to our policy. And normally you would have to show that you have repatriation and medical evacuation benefits in your insurance. So if you don't have that, but if you can prove or somehow confirm to us that you're not going to be studying physically in the United States, then we might be able to do a special exception and still be able to waive you out of our insurance. So I just wanted to put that out there because I know that's something on a lot of people's minds and a lot of questions about that lately with the international students. And if you have more questions about that, you know, you could put them in the chat and then we'll answer them.
One more piece to add to that, from what I hear, there are different companies that offer health insurance to international students that meets the criteria. And if that's an option you're going to choose, please check with them to see if they will pay you back if you come to student health. From what I understand, most of them do, but it's always good to double check. So if anything comes up and you have a medical need, you can come to student health. We would see you and do whatever needs to be done. There will be charges that go to your billing account, and then you'll have a receipt to give to your insurance. And again, they may or may not pay you back. Hopefully they will, but it's always just good to know how much they're going to pay you back, so you're just prepared should the need arise.
We do have a question in the chat about potentially having a gap in their insurance coverage. So they've graduated from another institution, and then there's a gap in time between when they're going to start at UCSB. We really are limited having our insurance being just a student insurance policy. You have to be a UCSB student in order for us to sign you up for it. And so if your start date at school is not going to be until September, then that's the earliest that we would be able to enroll you in our insurance plan. So it's always really lined up with the dates of each of our academic terms. Those are going to be your coverage dates. And so once you become an active student at UCSB, we'll start your insurance plan right away. And if you're able to, I think we do have like an early start just left for that first week or so, or 2 weeks before your very, very first quarter starts, which we could enroll you in just those few weeks early if you're going to be here early. But other than that, that's the earliest we can start your coverage. But once you do start, there are no gaps in coverage. So the way it works is it starts with September when school starts, and then your insurance plan will keep getting renewed. If you're in our UCSB health insurance, we'll just keep renewing your policy, and it carries forward each quarter. And during the breaks, when you're just having a break from school, in between quarters, you're still covered. So we still have coverage between in between the 2 quarters, or also during summer. Your insurance plan actually for spring, it includes summer. So your coverage for spring would start at the beginning of the quarter in spring, but go all the way until the end of summer. That way there's no gap. And then when you start school again in the fall, we start your next coverage at that time.
Hi everyone, my name is Karina Herrera, as I mentioned, and I'm the Immunization Compliance Coordinator for Student Health. All new students are required to submit immunization documentation, as well as go through a TB screening. These requirements will be due prior to your winter quarter registration. We highly recommend that you submit them prior to your fall registration. However, it will not be enforced until winter quarter. If you are not going to be on campus for winter quarter, please do reach out to our office, which I will include our email in the chat, and we can work with you to make sure you are not blocked for your winter courses until you are able to access services in the US or access services at Student Health. Keep in mind that if you do have to submit a TB test, that TB test does need to be dated after September 1st, 2019 in order to be accepted. The other requirements you will need to provide proof of are MMR, which is measles, mumps, and rubella, varicella, Tdap, which is the whooping cough vaccine, and we do have a meningitis requirement. So if you have further questions, please feel free to put it in the chat and I will answer them. Thank you.
And another point for the group to keep in mind is we have social workers that can help. So if you're going to be in the country and you're not going to have insurance coverage until UC SHIP kicks in, you can contact one of our social workers and they can help give you what options you have to get coverage for that gap period.
Great, thank you. If one of you would like to just kind of give an overview in terms of the type of care and services that Student Health provides, so that our students kind of know what they can go to, and then if you don't offer a specific service, then what do they do?
Do you want to take that one, Dr. Javenbach, or?
Yes, sorry, can you repeat the question?
Sure, so just an overview of the types of services that you provide, and then say there is a specific service that students need but aren't able to get at Student Health. What's the process and how do they get the care that they need for that particular care?
So at Student Health, we offer a pretty broad range of services. So we offer primary care, which means that kind of the general stuff that most people will need, whether it's a need that comes up like an illness or an injury, or if someone has a chronic condition that needs managing and taking care of, like asthma. We can do x-rays here, we can do blood tests. we have a pharmacy, we have physical therapy, and as Stacey mentioned, we have a dental center, an eye care center. If it's something that we don't have, then we can at least see you and determine, okay, what is your need that we don't supply, and then give you a referral, basically tell you where to go and who in the area can address that need. Yeah.
Great, thank you. And if they do get referred to another location, will our health insurance cover that care?
Go ahead, Stacey.
Yeah, so yeah, our student health insurance is good, not just in the student health center, but it is actually a nationwide plan, and it even includes international care as well. So if you're enrolled in UCSB, which is the name of our insurance plan, then you just go to either the provider that we refer you to, if it's somewhere here in town, or if you're away, you're not right there on campus, you can also see doctors that are in the network. In our insurance plan, our medical is through Anthem Blue Cross, and then we have our dental coverage, which is through Delta Dental. It's a Delta Dental PPO. And then we have our eye care, which is our eye coverage, which is through Blue View Vision.
Great, thank you. Looks like we have some additional questions coming in. Let's see, do I have to get a referral before going to other places?
You only need a referral to go to an outside doctor's office or provider if it is within 50 miles of campus. So that is our rule with our UCSB insurance, is just within the 50 miles surrounding campus. You need a referral from student health. So you have to come to student health first and then get the referral to get to go out to like see a specialist. If you are outside of the 50-mile radius, then you don't need a referral from student health. You can just go to an in-network provider and use your insurance coverage.
I'm a transfer student who starts UCSB fall 2020. Is it possible to receive insurance coverage from UCSB for my last varicella vaccination scheduled July 24th, since I haven't paid tuition yet?
So if you're requesting that for compliance, it is okay to wait until your insurance is active, but I do understand if the question is if you could have insurance early. So I will let Stacey speak on that.
Yeah, so you can't receive the insurance early. So the answer to that question is no, we can't activate your insurance any earlier than when school starts, or possibly a week or two before school starts if you're here on campus for like a special orientation session. But like Karina suggested, you may be able to have your vaccination scheduled for a later time once your insurance is active, and then get it.
What are the requirements for insurance in our home country?
So I think the meaning of the question is, in order to waive out of our insurance, what are the minimum requirements that my home country insurance would need to have in order to waive out? So we do have all of our waiver criteria posted on our website. So if you're interested in waiving out of our UCSB insurance plan, please go there first, because you can read all the details of what's the minimum amount of coverage I need to have, what will meet the criteria. And then, as I mentioned before, the really tricky part is with international students. When we review your insurance plan initially, we're always going to be looking for that repatriation and medical evacuation benefit. So if your insurance plan does not currently offer that, you would, if you're going to stay in your home country and you're not actually ending up coming to the United States for fall, you would have to reach out to us to request a special exception to the waiver policy. Or if you are planning to come to the United States, you would have to make sure that you have insurance that includes those options or those benefits. And I do see that next question about if we don't want to enroll in UC SHIP insurance, is there another health insurance plan that we recommend? We're really not allowed to recommend any other outside insurance companies. I think on our website, we do have a section for international students. If you want to click there, we do have a little bit of, here's some policies we know in the past that students have liked or have gotten their waivers approved by signing up for and purchasing these other outside plans, but we don't recommend them. We have no affiliation with any other outside insurance plans. So full disclaimer, we don't recommend any other outside insurance plans because they're not affiliated with UCSB.
And I just do want to say that, I would highly recommend, and our office really would recommend, that you do enroll in the student health plan for your first year at least, because it is a different system here in the United States, and there's going to be so many different things that you're trying to get used to and navigate and all of that. And student health is a really wonderful resource for students here on campus. It's close by, the staff is great, you can get all the necessary care that you need, and it just makes your life so much easier just to have that plan and be able to utilize student health when you need it. So I know there's questions about opting out and whatnot, but when you actually get here in the United States, we really do recommend that you go with student health and the student health plan, just to simplify your life, because you are going to have a lot of changes and adjustments that are going to be required of you, and that's just one less thing that you'll have to worry about.
We all agree.
Student health, let's see. Grad student on the department's website, I've seen that 90% are covered by insurance in serious cases. Is there a possibility to get an additional insurance in order to get all of the costs covered?
I'm not sure if I understood that question. 90% are covered.
I wonder if they're talking about like the out-of-pocket or the co-insurance rate, like UCSB covers 80% and they have 20% for certain things.
Yeah, I'm not sure if that's what they mean. That the grad department, like the academic department, would be posting things about insurance coverage, or if they mean that they are assisting students with getting insurance coverage. I'm not sure what you're referring to, but all of our benefits are, you can access the full benefits catalog on our website. And we also have some summary of benefits, just like kind of the highlights of what's covered and what would your out-of-pocket costs be. Unfortunately, like in the United States, it's very hard to find something where 100% is covered and there's no out-of-pocket. That's pretty rare. So with our insurance plan, it is, there are a lot of things that are covered at 100%, but not everything. So you can kind of review some of those benefits and just see what different situations might end up costing you. So like, for example, something that is covered at 100% would be our behavioral health visits. So if you want to sign up for counseling or to see a psychologist, that kind of thing, those ongoing visits, you just make those appointments and you have an appointment every week or maybe 2 appointments every week. Well, we decided that we wanted to have 0 copay for those visits, and the visits are covered at 100% rate. And then, there might be other types of doctor visits where there is a copay. So for example, like physical therapy, there's going to be a copay each time you come to see our physical therapists. Right now it's $15 per visit. If you go outside in the community, it's $25 per visit. So there are certain things that are going to end up with a little bit of out-of-pocket cost, but we do the very best we can with tailoring our benefits to what our students want and what they need. And we're hoping that you'll see that the insurance coverage we've put together for you is, it's for the price that you pay for it. It is very good coverage as far as United States-based insurance plans. For the cost, it is very good coverage. And you can kind of compare with some of the other policies that are out there that are available and see what you want to do. It's really your decision.
And then just to verbalize this, it was asked in the chat about if there would be a block on fall registration if you don't get your immunizations in. For fall 2020, there would not be a block, but in winter 2021, there would be if you didn't get do the compliance with immunization requirements. And our office works with student health to politely remind you to get your immunizations in during fall. So if you don't meet that requirement starting fall quarter, both of our offices will be in contact with you. So please do get those in before fall if possible, so that we do not have to give you polite reminders, and then you won't have to worry about getting blocked in winter 2021.
Thank you. And just to add on that, if you currently know what your status is going to be for winter, do reach out now and we can set that plan up now. So that way you don't have to reach out when fall quarter begins, when everything is just kind of starting for you. So we're happy to help.
Or, go ahead.
Sorry. I was going to say, somebody did ask, where do I email if I have more questions about the insurance waiver? That goes to, we have an insurance email address that we posted in the chat, but I would also encourage you, if you want to speak to us on the phone, we have a way that, that you can get a hold of us on the phone, even though we're working remotely. You click on our website and there's an opportunity for you to join a line, and you just choose which type of question you have, whether it's insurance, immunizations, or if you just have general questions about student health. You can get in line and then we'll call you. I'm sure it's a little bit difficult if you have an international number, so we'll see how that works. But emailing might be the best way for you if you do have one of those international numbers. So we posted that email in the chat there, and we're happy to answer your questions. But also make sure you read our website, because we've worked very hard to put as much information as we possibly could, thinking ahead of what questions folks would have. And so do read through all the information on our insurance website. I'm constantly updating it and making sure it's current and helpful information. So we highly encourage you to read through that first, because you might find the answers to your questions just right there in those informational pages, and then reach out if you still have questions.
So someone had a question: what if I'm unable to complete immunizations before winter quarter due to a shortage of certain vaccines in my home country? What can I do?
So in that situation, again, you would reach out to our office and we would develop a plan. So when you do arrive on campus, we can assist you with getting those vaccinations, whether it's at student health or if you have a private insurance and prefer to go off campus, then we can help you with that process as well. So it's okay if you can't get it done in your country. We are aware that there are certain countries that don't have access to certain vaccines. And so we will work with you and exercise as much flexibility as we possibly can.
Okay, thank you. And then for students, if there are any students who have either spouses or children, what health insurance coverage options do they have through the student health plan?
Great question. So we do offer the ability, if you have spouses or dependents, we do offer the ability to add them on to your student health insurance plan. So the information about that, you'll find it on our website under insurance, and then under voluntary and dependent insurance coverage. We have all the information there as far as the prices and what's the process to get your spouse or child or the whole family enrolled in UC SHIP if you would like to go that route.
All right. Is the UCSB campus going to open for sure in fall quarter so that we can complete all the immunization compliances at Student Health?
So yes, it's currently open now. However, when you are a new student, certain students don't have access to the Student Health Center until September 27th or after. So you wouldn't be able to request those services now. You would have to request them after September 27th. So we wouldn't be able to schedule an appointment till after then. But yes, they are open and fully functioning.
Thank you. So yes, if you do manage to find your way to Santa Barbara for fall quarter, our office will be giving you more guidance in terms of the immigration implications of that. But in terms of Student Health will be open to help you once you get to campus and your health insurance has kicked in. So not to fret about that, don't fear. We're here to help you. But do be very communicative with both our office and Student Health. That way, we can help prepare you and minimize any sort of stress as much as we can. So, definitely reach out and ask us questions if you're not sure. Both of us have pretty thorough websites, so, do your own research as well. And then, that way when you come to us with a question, maybe it'll be a little more specific, and we can help you with your specific situation instead of having to go through maybe some more general overview. So definitely read the websites. They have a lot of good information for you. Are there any other questions that we can answer? Or any other subjects related to student health that we need to touch on? Or if there's anything that the student health folks feel that we haven't touched on, or tips or anything like that, common mistakes or misconceptions students may have about student health that you wanted to pass along. I think for our office, the one big thing that we see is students thinking that they can just get antibiotics whenever they want them. Here in the United States, antibiotics are given by prescription from a doctor, so you can't just go and ask for antibiotics whenever you want. You have to actually go see a doctor, and they need to see that you'll need to get a prescription for those. So don't be alarmed if they say here's some Advil or some cold medication. They're truly trying to make sure that they're only using antibiotics when necessary. So that might be one difference from your home country than here, where it is a little more specific when you're given specific medication.
I'll add a little something that I know that Dr. Javanbach, he had to jump off of the call, but something that he always likes to say to the incoming students and parents, and that is, no matter what, just make sure that you have a plan, that you've worked through, whether this is a room full of parents here or if there's some students on here, just make sure that you've worked out with your family, what is your plan going to be if something does happen and you require immediate medical attention. So whether that's when you're in the United States and you're far away from home, if you can stay in our student health insurance plan, that is going to help you a lot as far as just being able to present yourself to student health, and we'll take it from there, and we'll help get you the care that you need, and you won't have to worry about any financial barriers or, you know, questions on like, oh, well, who takes my insurance? Or if you decide that you do want to waive out of our insurance plan and have your own private insurance plan, just make sure you do have an action plan, or that you know that, hey, if my student is going to just go to student health without having the student health insurance, because you can still go to student health as an active UCSB student. We don't require you to have our insurance in order to come and see us at student health. Any student can come to see us at any time. But if you do come to student health and you understand, okay, there's going to be some charges, and those charges may show up on your student billing account, and then, you know, maybe the parents will just pay those charges out of pocket. Just make sure you have a plan, because what happens sometimes, which it makes us so sad to see, is a student will come in, they have issues, they're waived out of our insurance, and then it's this scrambling of like, oh, well, I need to talk to my parents and find out, can I just have these charges show up on my billing account? Or, oh no, I need to get somewhere off campus to go see a doctor, you know, that's miles away maybe. So we just want to make sure that when you do come to campus, that you do have a plan. And so if that's being in our insurance, great. If it's not being in our insurance, then that you do have those conversations with your student as far as where can they go, what's acceptable, are you going to just pay for the charges if they come to student health, that kind of thing.
There is a question, do you require English translation for using a home country insurance to waive?
Oh yes, I mean that has been an ongoing little bit of an issue for us. We do ask that if you have your policy information in English, that you please provide it, because we don't have translators. We don't have that level of staff available to be able to translate it. So yes, in English would be the best thing so that we can review it. If it's going to end up being a very special exception because your student is not coming to the United States, those we have to make a special exception anyway, because chances are your home country insurance is not going to meet the criteria, our normal criteria to waive out, because normally we would have all of our students on campus in the United States. But if on the chance that your student isn't able to come to the United States yet, then, and you're trying to waive out of our insurance, we're probably going to have to make a special exception anyway. So if you don't have an English translation of your insurance plan and it's impossible to get one, that's probably going to be okay. But because we're more concerned with, are they even going to be in the United States? And if we can have some sort of card that looks like an insurance card, or some sort of a document that looks like you have insurance coverage, even if we can't read it all because it's not all translated into English, it's probably going to be okay, because we're just making a special exception anyway, if that makes sense.
Can I use simple literal translation for some medical certificate? For instance, immunization records.
So for your immunization records, we will actually allow you to translate them for us. So what you can do is you can use our helpful immunization worksheet, which I will include in the chat in a moment. And you are going to translate your records for us, but you're also going to attach your original records when you submit that translated document. We will accept those records. We just have to have you complete that translation for us first. Thank you.
Great, thank you. And then say for our students or any student on campus, if their parent wanted to call into student health and get information about their health records, or what they've gone to see the doctor for at UCSB, are parents allowed to get any of that information?
So actually, your parents will need to fill out a medical records release form. And this is something actually that you will need to fill out and give your parents access, because at Student Health, we do not relay any medical information to anyone who is not authorized. This is your protected information, even from parents and friends who call, who try to schedule an appointment or get information. Unless we have that written medical release on file, we are not authorized to release that information. So you must complete it, giving them access. I will also provide that in the chat as well.
So to be clear, the student has to authorize access to those records, even if you're their parent, even if you're paying all the bills.
And that goes for all of your student records here at UCSB. They're your records. So in order for anyone else to have access to them that isn't affiliated with maybe a specific office that handles those records, you need to give authorization. So don't think that, any of your grades or anything like that is public knowledge. It's your record. And if you wanted to give your parents permission to gain access to those records, you would have to give that authorization to the school specifically. So just keep that in mind. That's not just for the students to hear, but also for the parents, that you can't just call up an office and ask information about your student, whether it's related to grades or their health records. Your student will need to give permission for you to view those or get access to those. All right, any other questions? We'll just give it a minute or two more. Let's see, can I have access to student health when enrolled remotely from my home country after signing up for UC SHIP?
So yes, we are providing some remote services. So we've started doing telehealth, and you can actually schedule appointments with our doctors, and we can conduct a visit via Zoom. So that goes for a lot of our different services. Of course, if you're bleeding or you need someone to actually physically examine you or provide a procedure to fix you up, for lack of better words, then we will be able to do that remotely, of course. So, but the great thing, so UC SHIP does actually, let's say you didn't have your own national-based insurance or a home country insurance where you're from, and if you're signed up for UC SHIP, there are benefits that you can use internationally. So, you can seek care in your home country and use your UC SHIP coverage, because it is a full medical plan that's not only nationwide, but there's also that international insurance coverage as well. So, but it just depends on what you already have in your home country.
All right. And any other questions that you might have? You have some experts here, so take advantage if you have any questions at all, so that we can get those answered. Otherwise, definitely, contact Student Health after if you think of something that wasn't answered in this webinar. I guess one other question that we could pose is that, kind of related to the last question, if students do travel around the United States, say, in summer break or something like that, after being a student here, can they use student health coverage around the US?
Yeah. So like I mentioned, that the medical benefits are through Anthem Blue Cross. And so there's a nationwide network of doctors. So if you're traveling outside of California or, other cities within California, or even if you're traveling abroad, the insurance company still covers you. So there's still, you still use your insurance to, if you have a medical emergency or you hurt yourself or get sick and you need care, you can still use that insurance anywhere, and it covers you during the breaks. So there's coverage during, the winter break in between fall and winter quarter. There's coverage, it takes you through spring break, and it takes you all the way through summer. So there shouldn't be any gaps in your insurance coverage if you're using UC SHIP.
Thank you. All right, last call for questions.
I was gonna, I think another question just came in, but I was gonna also add too, we do get some questions about, let's say that we want to waive out of the UC ship policy for fall because maybe we're not coming to the campus yet. But then let's say things open up and you're able to come to UCSB later on in the school year. So what happens? I just wanted to talk about this, that, normally you ask for a waiver at the beginning of the school year, and normally we would just waive you out of the insurance for the entire school year. With the international students, if we make a special exception for you to approve your waiver and you didn't meet the normal criteria, what's probably going to happen is we're going to ask for you to submit that every quarter. And then conversely, what will happen is if you're able to come to campus and you want UC ship, if you're still waived out and we haven't notified you about canceling your waiver, or you need to re-verify what your insurance status is, if you haven't heard anything from us and you're waived out of UC ship, but you want to get in because now your student is in the United States and you want them to have all those benefits, and especially be able to come to student health without having to worry about any additional costs. Let's say you want them into ship, you do need to just reach out to us and just ask us to cancel your waiver. So like for winter quarter or spring quarter, if it's in the middle of the school year, if you've been approved for a waiver previously that year, reach out to us and just let us know if you want us to cancel your waiver, and then we can let the student get enrolled in UC ship for the following quarter. And then I think there was a question about international students being asked to quarantine for 14 days once they arrive at UCSB. I don't think they have any policies like that in place yet. Usually Dr. Jabenbach would be here to answer those questions about COVID-19 and what the campus is going to be doing as far as prevention and treatment and all of that. So those are questions, a lot of those questions more have to do with housing and where they're going to live. So, the UCSB student housing, if your student's going to be entering that housing, then, they're going to have their own sort of procedures, and they have not finalized anything as far as what's going to be required. I'm sure it would be nice to be able to know for sure, have every student tested before they move into campus, but logistically don't know how feasible that is going to be. So nothing's in place yet, and nothing official has come out yet as far as that process. Oh, and we got a question that said, will you audit the waiver even though the waiver is approved at front? Our process for approving waivers is that we're going to be checking to make sure, A, that your insurance meets all of the criteria to be eligible to waive out, and then B, that it's active. So we have to be able to confirm that your insurance coverage is active. If we've audited, and by auditing, I mean we've checked those two things and we've approved your waiver, then you're approved. And so every once in a while we might re-verify or check to make sure that your insurance is still active. But that's it. We would notify the student if ever something came up to where we were suddenly not going to have their waiver be approved anymore. So I'm hoping that answers your question. Just getting approved for that first quarter, normally it is carried forward for the rest of that school year. And typically we won't recheck the insurance to make sure it's still active until like springtime, and we're getting ready to go into the next school year. But then you can always reach out to us if anything happens. If you lose your coverage or you want your student to get enrolled in UC ship and cancel your waiver, then you just need to reach out to us.
Thank you. Any other questions before we wrap this up? And once again, the general student health questions email address has been posted by Karina, and you can find all of those contacts on the student health website as well. Let's see, we do have one more question that came in. What are the provisions for the quarantine if a student is infected with COVID-19, like regarding emergency supplies, medicines, food?
Mm-hmm. So, I mean, usually Dr. Javenbach would answer these questions because he's part of the campus-wide committee that's in on all the discussions surrounding COVID-19 and what their plans are for reopening. What I've heard him say is that there are talks about having there be a section of housing that is reserved for students to be moved into if they test positive. So they would actually quarantine that student and still be in student housing. And then, you know, they would work out a way for their meals to be accessible if they have a meal plan and all of that. Making sure that our student health professionals are checking in on that student, if they need treatment, that kind of thing, just following up with that student. So that's if they live on campus. We can very much control situations when it comes to our students who live on campus in our housing. What we can't control is the campus community that's right next to UCSB, which is Isla Vista. We don't have any control over, you know, quarantining or that kind of thing. So if they do test positive and we know about it, you know, of course, we're going to be first coordinating their care just to make sure that they are getting treated if they need to. But the Isla Vista community, it's not under the ownership of UCSB, or, you know, it's not controlled by UCSB. So that would actually be the county's territory. And so the county would be the ones, you know, coordinating the contact tracing. And, you know, if there needs to be some sort of emergency quarantine, the county does have resources in some cases. So, but it's, we're a little bit removed from that, the control over that situation, if that makes sense.
Thank you. All right. If there aren't any other questions, we'll go ahead and wrap this up. I do greatly appreciate Stacy and Karina for staying on and answering all of these questions. We really appreciate it. One last question.
Just saw that.
If one is deferring to winter, then when does one have to get insurance for fall?
Oh, okay. So yeah, if the student is not going to be attending UCSB at all for fall quarter, then there would be no fees charged and therefore no insurance being charged or enrolled. So the student would not need to take any action as far as either getting insurance or waiving out of our insurance because they wouldn't be a student yet. So that's a good question. But yeah, if the student decides to defer and doesn't start their actual enrollment at UCSB until winter, then that would be the quarter to take action as far as either, well, you take no action, you'll be enrolled in UC SHIP, or take action to waive out of UC SHIP insurance.
Great, thank you. All right, that will be our last question. If you have further questions, please reach out to Student Health via email. I think that's the best way for you, especially international students outside the US, to get in contact with them. And just be patient because they do get a lot of inquiries. They service all of campus, so they will do their best to get back to you in a timely manner, but just give them a little bit of time to respond if you do reach out via email. Once again, thank you so much for being here. We really appreciate all the information you provided. You did it in a much better way than I ever could. And I'm so thankful that you are here because there were a lot of questions that I may not have been able to answer. So I truly appreciate your time and your support of our international student community. So to all of our students, we hope that you stay safe and healthy, and we look forward to welcoming you to campus as soon as we can. We will continue to give you information as it unfolds. And if you have any questions, do not hesitate to reach out to either of our offices. We're here to help you. So thank you for joining us. And this has been recorded, so if you want to go back and watch it, you're more than welcome to. It'll be posted on the OISS website. So thank you again, and I hope everyone stays safe and healthy, and we'll talk to you soon. Bye-bye.